Among the most promising emerging drivers in breast cancer medicine, beyond the prototype estrogen receptor and, of course, the human epidermal growth factor receptor, is the recognition of multiple signaling pathways that they drive the disease, and of course the deficiencies in the DNA repair system. As we're learning more, we have learned about the importance of the BRCA1/2 mutations in the effectiveness of the DNA repair system, which led to a revolutionizing treatment in the BRCA mutant state with the PARP inhibitors. A very successful example, proof of concept, defining a molecular biomarker and developing in an expedited manner this targeted therapy, PARP inhibitors. The elucidation of and the importance of the PI3 kinase pathway with several compounds, some of them approved in clinical practice and many of them in development. Another important category focusing in what implicates the biology in cell cycle regulation, CDK4/6 inhibitors, with very successful treatments recently approved in the advanced disease setting and in clinical development in the primary therapy. Other very exciting areas, of course, developing immunotherapy in breast cancer, how to be able to treat and prevent the escape to immune surveillance with the development of the immune checkpoint inhibitors as well. But beyond all the targeted therapy, specifically targeting the vulnerability of the tumors, we have learned so much about the disease biology, and we're embracing and widening the concept of how we address the disease, as this is a manifestation of multiple factors and the balance between genetics, lifestyle, and environment. So an emerging area of interest is, of course, the how we target the axis of obesity, inflammation, and aromatase. So the local biosynthesis of estrogens by the help of the catalyst, the aromatase, is recognized as a driver of breast cancer malignancy. So that's a very interesting area of investigation as well. Exciting times ahead for 2018. Advances in technology, they're bringing us day by day closer to the implementation of precision medicine. So I would say that we're anticipating to be in a position where we'll select patients appropriately. Refine our tools for patient selection, develop more appropriate targeted therapy, and make progress with what is a biomarker-driven clinical trials that will expedite drug development. A very important step forward is the development of preclinical models which resemble the normal conditions of the tumor. They're modeling the tumor ecosystem And these preclinical models are allowing us to process large-scale drug screening, which will definitely expedite drug development and bring effective treatment for the cure of breast cancer. There are several topics, critical topics addressed that will implicate of how to provide clinical care. Among the highlights, I would say, is whether or over-treating patients. An example of a presentation, the use of trastuzumab in the HER2 low expressing tumors. We learned today that this is not improving outcome. It's a very significant piece of information for treating these patients, sparing patients from unnecessary toxicity, and of course, all the considerations relevant to cost of these therapies. The duration of adjuvant therapy, because we all tend to overtreat, with all the implications of overtreatment, especially for toxicity and again cost. Important studies that will be presented here. Again, the Mona Lisa 7 this afternoon, giving us information about the role of CDK4/6 inhibitors in the premenopausal setting, hormone receptor positive disease. Also the Panacea study, exploring the role of immunotherapy in HER2 positive disease. Several other abstracts, again, addressing critical issues, very significant in the daily clinical practice, as, for example, the implementation of acupuncture to help with symptoms associated with adjuvant treatment in hormone receptor positive disease.